Position the patient for comfort and privacy and access to the chest tube insertion site. If the patient has a pneumothorax, place him or her in a lateral supine position. If the patient has a hemothorax, assist him or her to a semi-Fowler position. Collaborate with the practitioner regarding the need for analgesia or sedation, particularly if the patient is experiencing pain or agitation, or if the patient is unable to cooperate with the procedure. Administer prescribed medications. If sedation is needed for the procedure, perform moderate sedation monitoring per the organization's practice, and ensure that emergency response equipment is available. If a sedative or an analgesic is administered, reassess the patient's pain or sedation status, allowing for sufficient onset of action per the medication, route, and patient's condition. Perform hand hygiene and don gloves. Comply with universal protocol. Assist the practitioner as directed with preparing the sterile field. Open the chest tube insertion tray and appropriate supplies as directed, using aseptic technique. Assist the practitioner as needed with cleansing the skin of the patient's chest with an antiseptic solution, for example, 2% chlorhexidine-based solution, per the organization's practice. Remove gloves, perform hand hygiene, and don a cap, mask, eye protection or face shield, sterile gown, and sterile gloves. Assist the practitioner as needed. Assist the practitioner as directed with draping the patient. Place full sterile drapes over the patient, leaving only the procedure site exposed. Assist the practitioner as directed with the procedure. After insertion of the chest tube, connect the chest tube to the chest drainage system. Check for the rising and falling, titling of the water column in the water seal chamber. Apply the prescribed amount of suction. After the tube is sutured in place, assist the practitioner with applying an occlusive dressing. Place split drain sponges around the chest tube, one from the top and one underneath. Cover them with a gauze dressing. Apply foam or a similar all-direction stretch water-resistant tape over the dressing. Label the dressing per the organization's practice. Tape all the connection points between the chest tube and the chest drainage system. Secure the chest tube to the patient's skin below the dressing, using a tube securement device or tape. Ensure that a chest radiograph is obtained.